Okay, I think it's a good time to start. First of all, welcome everyone to this week's webinar on COVID-19 experiences from primary care in Europe. Just to give you a brief introduction, my name's Tom Carter. I'm the Junior Coordinator for the European Forum for Primary Care. I'll be facilitating today, and then alongside my colleague Pim de Graaf will be moderator today. First off, just want to go quickly over some rules for today's session. So if we can, it's great to see so many people participating, but we do ask that you keep your webcams and microphones off for this session. This is just to avoid internet connection problems and any sort of background noise. But please feel free to use the chat box as much as possible for comments or any questions. The overall session is recorded and put on YouTube, and we make a recording of the chat box as well, so that's not a problem. I'd also like to draw your attention to some of the work that we've been doing as a forum. We currently have a survey out on the organisation for primary care surrounding COVID-19. So we have questions on aspects such as collateral damage, resilience, safety and testing procedures. It's divided into two parts, so we have process and guidance and experience and observations. And as you can see the link there, we would be really appreciate your input if you could take some time to fill in the survey. Not necessarily fully, you can of course fill in as much as you'd like, but it'd be really helpful. Myself and another colleague, Sarah Bergman from the forum as well, will be writing a short publication on the results of this survey, as well as some of the work we've been doing in relation to collateral damage, specifically caused by COVID-19 to health systems. So that'd be much appreciated if you have on that. Lastly, we do have our Pi platform as well. So it is our online platform where you can share problems, ideas and experiences about the COVID-19 pandemic in your country. So you can share and review all of the certain posts that we have on our forum, as well as reply to them and create an online discussion going. It's really useful to have this because we have already quite a lot of stories and strategies and things such as that on there already from all sorts of different countries around Europe and the rest of the world. But if you can't, of course, have access to that from the link, or if you have issues with it, we also have an alternative Google Doc where we're also collecting the same thing. Okay, so without further ado, what I will do is hand over to our moderator, Pim. And if you have any questions, feel free to put in the chat box, as I said, and have a great session.
Yes, good afternoon, all of you. My name is Pim de Graaf. I'm an ex-GP and a public health consultant in the Netherlands, and have many years of history with the European Forum for Primary Care. So welcome again. We have many participants today. Most are from the Netherlands, as we can tell from the lists of people that joined. But also from Hungary, Slovenia, Italy, UK, and maybe one or two other countries. And also we have participation from the World Health Organization. So this is a wide audience, and that is one of the reasons why we thought that contributions should happen mainly through a chat box. And so if you have any question or comment to make, you're welcome. But in order to keep the things clear, we prefer not to use the microphone. So this webinar actually is to share some experiences of primary healthcare providers in Europe. And we are not in the early days of the COVID outbreak. We are in the middle of it, and we don't know for how long it will take and what will be the future impact on primary healthcare. So we have taken a look at how in different countries primary healthcare providers, clinicians and non-clinicians are actually dealing with the situation. And that's why we have a series of short videos for you from different countries, and each of those videos create a topic for future follow-up and further discussion. So there are a few themes that you can identify in more in general through these videos, and one is changes to to the regular way of working of primary healthcare and what it actually means for care for patients. But it's also about impact on primary healthcare professionals themselves. You will see that. And then finally, there is the issue of, would this whole COVID situation also have some positive effects or stimulating effects on primary healthcare? So we approach this from these three angles. And so I would ask Tom to start the first two videos, and after the first two videos, we pause a bit, and you will see, we will discuss actually the scope of these two contributions.
Threat of coronavirus appeared, there were impressive challenges and changes in the organization and delivery of primary healthcare, focusing on patient and medical staff safety. Now, on the 1st of April, in total, we have approximately 450 infected persons, about 16,000 tests were performed, and 28 patients are hospitalized. 3 of them are in severe condition. Luckily, no deaths are registered so far. Since 16th of March, GPs have major changes in their work. Mainly, patients are consulted remotely, providing telephone consultations, and all team members of primary healthcare are involved in this work. Patients are still consulted in the practices according to the appointments in case of emergency, if problem cannot be solved on phone, and vaccination is continued all over the country. We try to provide the best possible care for our chronic patients, prescribing medicines on e-health, consultations on acute cases, exacerbation of chronic patients, and since closure of secondary care on routine consultations started, number of workload has increased. GPs take care of COVID-19 patients as well via phone. We monitor the severity of disease and we provide our advice on treatment. We provide checkups and sick leaves as well. GPs in Latvia face a lack of individual protection devices via short of masks, respirators, and disinfecting agents. Still, in this changing environment, the family doctors are trying to adapt to new conditions, and we are ready to prove that even in situation of pandemic and state of emergency in the country, primary health care can provide universal, holistic, and accessible care for all our patients and continue to provide our services in the best possible quality.
Ti volevo anche chiedere se, oltre all'aspetto lavorativo, fosse cambiato qualcosa anche nella tua giornata quotidiana, appunto, non soltanto per il tempo che passi in studio a lavorare.
Sicuramente passo molto più tempo a casa perché ho dato una maggior disponibilità telefonica e pertanto finché non ho esaurito, diciamo, di rispondere al telefono, spesso resto a casa perché tante cose appunto le posso fare anche da lì come se fosse in smart working. E poi sicuramente c'è un po' di preoccupazione anche nel ritorno a casa dopo essere stata in ambulatorio a contatto magari anche con quei pochi pazienti. Per cui in casa ho creato una sorta di percorso sporco in cui lascio tutto quello, tutti gli indumenti che ho indossato in ambulatorio a partire dalla giacca, la borsa, in modo tale da cercare di limitare il possibile contagio anche all'interno della casa. Probabilmente è soltanto uno scrupolo eccessivo, però si salva.
So far for the first two videos, you may have noticed from the flag on the first video that was from Latvia, and the second one from Italy. So to summarize the messages from Latvia, it is about, of course, remote consultation. And in the practice itself, there are still emergency consultations, and vaccinations continue. There's also some care for chronic patients, but most of what is done is through remote phone and videos, etc., with patients. A particular feature mentioned in the Latvia video was also that the workload of primary care has increased because secondary care is closed, or at least partially closed, due to the fact that hospitals have to cope with coronavirus patients. In primary care also there is care for corona patients, mostly by phone. If need be, they ask people to come to the practice, and that's why in practice they have also protective gear, PPE. So that's what you saw a lot on the video. The final words of the Latvia video were actually quite ambitious. It's a positive note. We try to adapt, and as primary healthcare, we continue to provide universal, holistic, and accessible care. And you know, that's a declaration of an ambition in Latvia, and indeed. Latvia is known for its quite modern and effective primary healthcare system. The second video, we saw a GP, her name is Sarah, working in a practice in the center of Italy. And she also mentions, of course, that there's a lot of telephone contact with patients now, and that some home visits are done, but not that many. She also emphasizes the impact on personal life of primary care providers, herself and her family. And that is a topic that we will come back to later after a few of the other videos. So from the two videos we had so far, a main issue is phone, long distance contacts with patients, also SMS, etc., smartphones, and but there is a question mark actually on the amount of home visits, in how far actually can home visits be done, and should they be done. GPs, of course, prefer personal contact above a long distance contact. If there would be on the chat box any suggestions or comments here, then you're welcome. Meanwhile, we continue with a third video, and that is a practical example of how personal protective equipment is used in practice, meaning during home visits. So that is the video from a GP in Italy. So Tom, can we see the third video from Italy? So this is a home visit. A video arrives at the home of a patient, and before entering the home really, or contacting the patient at least, he is donning himself with all the equipment necessary. So you see on this video what it takes to equip yourself, to protect yourself when you are doing a home visit. And this is in the behind the front door of a house in Italy. And So you have to put your gear on the floor. There is no chair or something else to put your gear on. So it's just one particular sign of improvisation that this requires. So while we are watching this, you're welcome to add comments or questions to the chat box. So one of the questions, of course, that in different countries we heard is that do GPs and primary care providers in general have sufficient of this protection material? And because there are shortages of these materials, and we have seen that in the masks and all the equipment. So any further information from other countries, this was from Italy, is welcome to make sure that we have a wide European information on this. It's also time consuming, of course, to put this gear on to protect yourself. And then the question is, should you do that for all patients you are visiting at home, or just for those that you expect that might be positive, corona positive? It's to protect the patient, and it's also to protect yourself as a primary care provider, of course. Yeah, so that in the chat box it says that he puts his bag and box on the ground with any protection. Yes, that's the point. So indeed, but if there is no chair or something else in that place, you have to enter the house further to do that. Indeed. So, but that's a good observation. So. And another comment now is a surprise of lack of hand hygiene in these videos. Well, at least the second one, you see that from Italy, that's the third one, sorry, is that he puts 2 gloves. So that's the question is indeed what is good hand hygiene, but indeed you can wonder how often you should change your gloves in primary care, and of course also about hand washing and hand disinfection. Maybe Tom, could you show us the next video, which is from Italy, and it is a clinical secretary who's talking to us. This is not Sarah, this is Laura talking.
Tu sei?
Laura,
Ok, cosa fai di mestiere?
sono un collaboratore di studio presso uno studio di Sesto Fiorentino.
Bene, ti volevo chiedere com'è cambiato il tuo vivere quotidiano relativamente al lavoro, ma non solo, da quando ci stiamo confrontando con l'emergenza coronavirus.
Per me è cambiato ed è cambiato molto a livello proprio emotivo, perché anche se al lavoro uno viene volentieri, però quando torna a casa la sensazione di essere stato comunque a contatto con delle persone, con dei medici, in realtà un po' di paura io ce l'ho. Mi viene logicamente spontaneo di fare ormai da diverso tempo determinati movimenti ripetitivi tutti i giorni, arrivare a casa, togliere le scarpe, metterle sul balcone, il giubbotto lasciarlo fuori, spogliarmi tutti i giorni e mettere tutto a lavorare per paura di avere io qualcosa, di contagiarlo ai miei figli, a mio marito. E quindi ecco, mi viene anche meno spontaneo l'abbraccio la sera e avvicinarmi troppo ai miei familiari, sinceramente.
Grazie.
Yeah, so this short video shows actually how the whole situation can affect people working in primary care, them, but also their families. It creates fear, and you have to change your habits at home. People are so afraid for this infection that one main question would be, of course, how often and how much is this impacting on family life, but also for how long can families and primary healthcare providers' families continue to work in these conditions. We get now more and more signals that the whole outbreak may take a very long time, not just in terms of months, but even years. And then the question is, for how long can people in primary care cope with this situation? And I'm now specifically talking about the impact on their personal life and the life of their families. So if there will be anybody who has also concrete experiences or examples of this issue, then please notify us on the chat box, and then we see whether we can talk a little bit more about that one. Then for now, let's go to a next short video. It's two sections from one video from Slovenia. It's a nurse from Slovenia, and she talks about some of her main concerns.
Working a lot now with our Midwives and Nurses Association with elderly homes, because there we have a lot of problems there also, because there are infections going on also, and they are our most vulnerable patients, and our elderly homes were not built in a way to do isolation, like cohort isolation. So we are trying to help them and to support how to do and provide this type of care. We have, like I think everybody now, a big shortage of protective gear. Our government hard to get them, that it's also safe for our healthcare workers to work.
We have, while we are waiting for the video to resume, we have a comment from Turkey, from a GP working in a hospital in Turkey, and they organize hotels for healthcare professionals after their shifts if they wanted to be isolated from their families because of the risks. Well, actually, that sounds like a very good idea. I also have a personal experience with that, in that when I worked in a hospital for a couple of days and came home, I had been in contact with COVID patients, and so my family could not work anymore with elderly people as they did before, because of the risk that I would contaminate them. And this solution in Spain and Turkey would be quite a good one. Thank you for sharing this example. Yes, the other comment also on yeah, you are carer also for family members, in this case your grandparents, and then indeed it's a big risk. And some risks you cannot avoid. So if you are the one who has to provide that informal care, yeah, then a hotel also would not be a complete solution. Thank you, Tom, for the second part of the video from Slovenia.
In a row, and then they have a week off, and so on and so forth. And in hospitals, they are working for 12 hours because we don't have a lot of staff. And a lot of staff is also in self-isolation because they got in patients who are COVID positive and they didn't know.
So this is also an issue of what the nurse from Slovenia is telling us is also an issue of lack of shortage of PPE and also in elderly homes where and I think that is a very widely a common phenomenon in Europe that in elderly homes or nursing homes there's a lack of PPE and there's a very high risk of contamination in those homes. So she's talking about that as well, with the hope that the government will help to organize that. And I'm afraid that we have to observe that different countries are competing with each other for protective material like masks, gloves, etc. And there is not yet a common approach in purchasing and distributing that kind of material. What the nurse from Slovenia also mentions is an interesting one, is that in hospitals, they, but also in primary care, they have changed the shifts. So in primary care, they do shifts of a week and then a week off. In hospitals, she mentioned, and I have seen that also in other hospitals in Europe, not only in Slovenia, but hospital staff is working in 12-hour shifts now. So which is a huge burden on their personal life and on their energy. Especially elderly staff in hospitals find it very difficult to work for 12-hour shifts. And that's another matter that asks for consideration if this whole situation is going to last longer. In primary care, 1 week on, 1 week off, maybe it's feasible for a longer period of time, and we would be interested also to hear from others in how far that is happening. What actually is the rationale behind doing shifts of a complete week, and for how long would that be feasible to operate? So that's an invitation to you all to comment on this one. Let's take 1 second to read the messages in the chat box. Okay, this is in a living home for young people with autism, also 1 week on, 1 week off. Yes, we have in the participants to this webinar, we have quite a number of physiotherapists and occupational therapists. So this question is about visit of elderly persons at home. And the question is, does that still happen? And so anybody who has practical experience with that is invited to contribute here. Let's see if we can come back later to the shift issue, the changes in the work schedule and the sustainability of that if the whole situation we are in now is going to last for a long time. So we find here from Turkey, I guess it's shifts of 8 hours in hospitals, and for primary healthcare, half-day shifts for the professionals. If you have those professionals available, what we see in various countries is that primary care staff itself is affected by corona, and some in a severe form that does not allow them to work for quite a longer period of time. But if that is not happening, then half-day shifts in Turkey, at least in one place in Turkey, is an approach they can afford. So we do have a short contribution from Turkey now, which is another example of the impact on primary care clinic. So Tom, if you could start the Turkey video.
As you see here, there are no patients now. Normally, we have at least 10 patients waiting for doctor visits here. But since our government has advised to stay home most of the time, our patients are much more like waiting at home and very rarely visiting our primary care unit. Let's move. This room is our isolation room for possible COVID-19 cases. Our government's advice is to have the patient wait in a room, and we have an emergency contact, and the vehicle or car comes and takes this patient to the hospital. Let's move on to other units. Here are our nurses. They are wearing scrubs now. Normally they don't wear scrubs, but since we have this epidemic, they started to wear these clothes because it's easy to wash them.
Yeah, I think this was a section of a video from Turkey and a primary care clinic, which was quite empty indeed. There is an isolation room, and what you maybe heard is that she's mentioning that they do have an isolation room for suspected corona cases, and they transport COVID patients also to hospitals by ambulance, and so, which actually raises the question: what is the policy in a country to do with COVID identified patients? First of all, are they identified indeed, diagnosed with a test, or are they suspected cases? And what is then the policy for referral to hospitals? In some countries, like the Netherlands, GPs, primary care, they keep patients at home, suspected patients. They get home visits mostly for confirmation, and then further long distance counseling and support, and only referral to a hospital when patients are getting ill severely. So the question is whether primary care has everywhere the same way of dealing with suspected patients and with patients who tested positive for COVID. So your comments in the chat box here also will be very welcome to share your experiences. By the way, if you have a suspected case in an ambulance, I guess that you need to clean the ambulance afterwards. So it is a heavy burden on the transport system as well. But that's then the way it is. The question is if not only about the policy to refer patients to hospitals or not, all cases that are positive or only the severe cases, but also about what is the policy concerning the transport. Does it need an ambulance or can that be done differently? And so that is coming from the Turkish short section. Yeah, so we have here a comment in the chat box on an occupational therapist who does patient visits at home if necessary, and after consultation with the doctor or the specialist or home care staff. Yeah, that seems very sensible to do. Many people need absolutely continuation of therapy, physiotherapy or other therapy. If you delay it too much, then the consequences will be large. It does not happen for nothing. So Tom, can you show us the video on the next one from Italy, and which is actually the last one for this session, and that is a GB Tommaso, is his name.
Maggiori opportunità di televisita e telemedicina grazie alle nuove tecnologie, quindi potremmo addirittura avere parametri in tempo reale o molte altre cose. E quello che io avrei pensato impossibile meno di un mese fa, adesso mi sembra tutto facile.
Yes, so Tommaso is again talking about the fact that his practice is empty. He had to change the telephone context. He cannot do ultrasounds, for example, so it affects the quality of care. But he does think that there are opportunities for organization of primary healthcare in general in Italy, which is digitalization of healthcare. So actually, that begs for the question: what other opportunities is this situation actually providing for primary healthcare, for the organization of primary healthcare? And is there any opportunity that people observe in their own countries, apart from all the constraints? What are the opportunities for primary healthcare? So you have seen several videos, and you're welcome to add your comments or questions in the chat box. And so we observe, of course, change in the functioning of primary healthcare. It's all becoming mostly remote care, remote consultations. Only for emergencies, you keep your patient, you receive your patients in your practice, and then you try to protect yourself and the patients from corona by using gear. In some practices, I see no gloves. In other practices, I see people wearing gloves. So there is no common behavior in primary care yet in between different practices and maybe between different countries. So that might be an area to look at. Do we have minimum standards of using protective gear in primary care? So that is one issue. The other issue is about how to conduct remote contacts with patients. In some of the videos, you saw that this became a common thing to do, and is seen also as an opportunity to digitalize healthcare further. One particular issue that we observe is that secondary care, actually, the relationship between primary care and secondary care is changing. We see that in one country, in Latvia, secondary care as much as closed for other patients. It's only dealing with COVID. So in primary care, you get a higher workload of patients that otherwise would be dealt with in secondary care. Actually, in different countries, there are now discussions ongoing on at what moment and how would secondary care start up again, because many patients delay now their use of secondary care, or primary health care cannot refer them, or they cannot use secondary care after previous referrals, and that may affect their health considerably, like cardiovascular people with cardiovascular problems, for example. So the relationship between primary care and secondary care is an important one. In one hospital, I observed that specialists intended to restart their normal routine work, like surgery and so on, but they were wondering, and after that surgery, will there then be home care, and will there be physiotherapy at home, for example, for patients once they leave the hospital? And so that relationship between primary care and secondary care may be different between different situations and countries, but it is important to focus on that as well. Another large section of the videos and our conversation is on the effects on primary healthcare staff themselves and their families. So your own protection, your own fear, and that is very common, of course, and not only for primary healthcare staff, but for anybody who is in direct contact with patients, corona positive patients or suspected patients. So that is one effect, and the other one is the shift change that happens in many situations, and of which the question is, for how long is it possible to sustain that? There are a few comments in the chat box. Treatment post-COVID at home, fatigue management, recovery of participation. And in the Netherlands, a guideline for post-COVID-19 is in development for primary care. So that is an interesting contribution. And once it is there, we would be happy to help share that guideline with other countries. So, and then there is a request if anyone has recommendations for getting information about online treatment sessions and during an internship. So is this for physiotherapy or occupational therapy? Please clarify for what kind of recommendations you are looking. Occupational, okay, yeah. So anybody who has their suggestions or experience, please share that after this call, after this webinar. From Turkey, we get a comment that Turkey is one of the countries with a decrease of patient numbers in hospitals, even in absence of a normal referral system. So people are afraid to go to hospitals. I think that is a common phenomenon in many countries. And then the question is, does that impact indeed on primary care with a higher workload, as we heard in one of the or two of the videos? So that is, what does it mean indeed for primary care? And does it indeed maybe is that a moment that primary healthcare is more appreciated and more accepted as a first line care offer? That and this last question refers to the question about opportunities. Do we see opportunities for primary care? So one suggestion from Italy was, well, it helps us to advance with digitalization. And now the order from Turkey is maybe that primary care gets more patients who otherwise would go to hospitals. So let's see what from Spain we get a comment that Spain is heavily affected by Corona. So nearly 30,000 family doctors are participating, and around, that is probably 1,900,000 cases have not been referred to the hospital circuit. So that is saving hospitals a lot of patients and workload. And so primary care has to deal with it itself. Agra Varela, could you maybe elaborate on this? It's an interesting case from Spain. So if you would open your mic and your camera, could you tell us a little bit more about this? Okay, maybe that doesn't work. All right, I would now invite, we are coming close to the end of this webinar. Sorry, it is, we had a few technical glitches with the videos. It's the first one, so we'll make sure that the next ones are impeccable. So we still have from Arnoldas Jurgutis, if I'm not mistaken, from Lithuania. In Lithuania, then there's less primary care, but also less hospital care sought for by patients. And they are much better engaged in self-management. It's happening, self-management, but the question is how much is it better than the care that they did receive previously? So that would be an interesting area to explore later on. When this lasts a little bit longer, and maybe there can be some research on what is now the effect when people have to provide their self-care rather than going to primary care or even secondary care. So from Spain, the confirmation is that indeed GPs in Spain treat patients at healthcare centers, home and nursing homes. And then they are not referred to hospitals. I think that is a common approach in the most countries. A question from Mehmet from Turkey: which countries have capability to test corona in primary care? Yeah, that is an important area of discussion. Testing in primary care, and what is a good policy there? What is a good guideline? In the Netherlands, for example, there is hardly any capability to test corona in primary care. Public health, regional public health organizations do testing nowadays since a couple of weeks, but GPs have very little tests available. And as soon as they suspect a patient to be very ill from corona, he or she has to be referred to a hospital to be tested. So this is only done for more severe clinical cases and not for others. And so then in Spain it is different. In most of the regions they have the possibility for suspicious cases testing. Would there be any other country that can share an experience here? The whole area of testing is an extremely complicated one because we do know that tests may be false negative. And in a rare situation also false positive. Sensitivity and specificity differ widely. So how much can we use tests actually to identify individual patients and even the outbreak as such? So I do think we have now quite some conversations on the chat box, so that please continue with sharing your questions and experiences. And while we come towards the end of this webinar, so we tried to focus ultimately on three areas. One is so the changing healthcare delivery by primary healthcare, the reorganization of practices, remote contact with patients, issues with the lack of PPE, and the relationship with secondary care. Then we talked about effects on primary healthcare staff and their families, which is so far rather anecdotal. but it's obvious that this is a concern for many, and there also we might benefit from a little bit more of systematic sharing of experiences. And then finally, we discussed opportunities that the whole situation now creates for primary healthcare, including digitalization and maybe more interest for primary care as such, since hospitals are so busy with Corona. And then finally, the issue of testing comes up. So that may be another area that we start to share experiences on. In many countries, or maybe in most countries, it didn't happen in the beginning, but now as tests may become more widely available, the policies there would change. So far for our conversation here, and I would now hand back to our operators, Tom and Diederik, who will make some final remarks and close the webinar.
Yeah, perfect. Thank you, Pim. And thank you everyone as well for your input as well. We got a lot of discussions going on in the chat box, so that's really great to see. Or just as a final reminder again, before we close off, just as you see on the slide in front of you here, the survey that we are conducting on collateral damage and resilience and other aspects of primary care in relation to COVID-19. If you can, please contribute to that. That would be fantastic. Really value your input on this, and it'd be great to have some varied results. Also, in terms of PI as well, if you can access that, more than welcome to share your thoughts and ideas. It'd be great to have a good discussion on there as well, and alternatively, Google Documents. Diederik, is there anything you'd like to close with yourself? If not, then I think we can end the session now. A little bit earlier than planned, but that's no problem.
What I want to add is that most probably we will have a second round of video statements, video reports from primary care with primary care in COVID-19 mode, with videos coming, an extensive video from Ljubljana, from the Ljubljana Health Center, and most probably from Austria. So we will inform you when these are ready and we are ready for a next webinar.
Perfect. Okay. Well, thanks again, everyone, for coming. Feel free again to add things more into the chat just before the end if you have any final comments. It's all recorded and saved. The recording from today will also be available for our YouTube channel. So, yeah, thanks again, and keep safe. And hopefully the rest of you have, well, working in this current situation, hopefully it's not too stressful and we all get through. Okay, thanks a lot.